we say swimmers ear in the UK. And this is the normal ear, so this is the non-infected ear on the patient's other side. I thought I would show you the non-infected ear first, because this gives you a good idea of what's normal for the patient. So there's a little bit of redness and dry skin around the outside near the entrance to the ear canal. But if we look here, there's dead skin, there's ordinary yellowish brown wax in the ear canal. I wouldn't say there are any marks here of infection, so swelling, redness, pain and so on and so forth. This is a fairly normal ear. And what we're doing here is just cleaning up, just quickly removing some debris so that we can visualize the eardrum. And then I'll show you the swimmer's ear, the infected ear. And lovely looking eardrum back there, the sort of greyish, shiny skin. There's just a little bit of residual dead skin there. But overall, lovely looking. So now I'll show you the infected ear. So this is the exterior. As you can see, there's redness, there's a fissure in the skin, there's like a crack in the skin right there. Inside the ear canal, you see that it's quite swollen. You may think that this is an ear filled with pus. I wouldn't say there's a huge amount of pus in there. It's basically kind of a sluffy ear, I suppose. There's a lot of wet, dead skin in there. So there's probably pus in there. I shouldn't say pus really, I should say pure. But either way, this is the sort of what you tend to find, what you'd expect in an ear with otitis externa. So the ear sheds lots of dead skin, which we've talked about in other videos. But essentially, you know, when there's an infection there, lots of growth, the white blood cells in the tissue will release growth factor, which will make the skin produce and fire very rapidly. So that's what rapid cell turnover. And you get this kind of rapid shedding of dead skin into the ear canal. And that's what we're dealing with here. And you can see just how narrow the ear canal is on this side compared to the other. But just flicking back quickly to the terminology, just to clarify, the terms swimmer's ear and surface ear seem to be used quite interchangeably depending on where you live in the world. In the UK, when somebody says swimmer's ear to me, I'm usually thinking a bacterial infection of the outer ear. Whereas if somebody says surface ear to me, I'm usually thinking that this is an ear canal with bony growths, which we call exostosis, which I've featured on another video. And you get these bony growths if you're continually exposed to cold water. Sometimes, not everyone gets it, but very common in surfaces, you can imagine. Whereas in other parts of the world, if you say surface ear to a doctor or a healthcare professional, they'll think that you mean bacterial infection. So those terms are used quite interchangeably. It's much easier just to say otitis externa, which is an infection, usually a bacterial infection, can be fungal, or just say exostosis, which is bony. But here you can see the ear canal's looking pretty clean already. We're not going to be able to get all of this wet dead skin because again because it's infected, the skin is very, very sensitive, and we certainly don't want to be poking around in there. We certainly don't want to cause any bleeding this patient will then be in line for drops. So she'll take some acetic acid drops, which is diluted vinegar potentially, and also get her general practitioner doctor to prescribe further drops which will contain acetic acid, and also the drops will contain a steroid and antibiotic, which is kind of the